this is my disclosure, I would like to talk to you today about trachyonychia, rough nails. Trachyonychia is a sign basically and not a disease, and it's also called as 20 nail dystrophy, but it's believed that this term, however, is not appropriate anymore and must be abandoned, as the dystrophies do not always involve all the 20 nails. It's more frequent in children, where it usually affects all the 20 nails, but it can occur also in adults and affect just few nails. As you can see from this picture, just 2 nails are affected by the disease. The average age of onset is 3 to 12 years old. So as I said, it's very common in children. It's more common in children than in adults. And fingernails are affected more often than toenails, even if toenails are more severe. So the disease in the toenails, probably due to the trauma in wearing the soles, is more severe. There is a male preponderance in children and a female preponderance in adults. Clinically, we talk about trachyonychia as a sign when the nail plate shows thinning and, above all, roughening due to multiple longitudinal ridging and superficial scaling. Hyperkeratosis of the cuticle is often present. Also, koilonychia may be associated, and it's a painless sign. So there are no associated symptoms. As I say, trachyonychia is a sign. I repeat this multiple times because it's the clinic. There is no onychomadesis, no breakage in the nail plate. Moreover, onychocytes retain their nuclei, and instead of maturing to form a compact layer of tightly adherent flat cells, they produce a stratum corneum-like layer that easily desquamate at a minimal trauma. The inflammatory infiltrate can be severe or less severe. The more severe is the inflammatory infiltrate, the more rough is the clinical presentation of trachyonychia. As I said, the toenails are usually more severely affected than the fingernail. This is a case, this is another case, and these are two pictures showing you the hyperkeratosis of the cuticle and also a slight trachyonychia that commonly presents together with the nail surface abnormalities. And remember, the nail plates are brittle. There is an easy breakage. It's like the superficial. There is an easy breakage. It's like the superficial. There is an easy breakage in evaluating trachyonychia, even if trachyonychia is a clinical sign. But as you may know, the dermoscope is a magnification lens, so you can better see what your naked eye is able to see. The diagnosis of the causative disease requires a biopsy. I told you before that trachyonychia is a sign of an inflammation in the matrix, but we don't know which is the inflammation without performing a biopsy. So trachyonychia can be a sign of idiopathic inflammation, alopecia areata, lichen planus, psoriasis, eczema, atopic dermatitis. But also a lot of other diseases that are inflammatory diseases can manifest with trachyonychia as a sign. You see here the list is very, very huge. The point is that trachonicia is a benign disorder. So most of the time biopsy is contraindicated, especially because children are those mostly affected by trachonicia. So it's not necessary to bother them with a biopsy because sometimes revealing the diseases is not so important. However, if we want to perform a biopsy, we could find at pathology a spongiotic pattern that is the most common pattern, is the pattern typical of eczema or atopic dermatitis, and the pathologist can tell you what he is looking in the matrix but also in the bed, because usually even if a punch biopsy in the bed, if possible, or in the matrix are less traumatizing than a longitudinal biopsy, the longitudinal nail biopsy is better to reveal the disease with all its potential. Maybe it could be in the future possible to make a certain diagnosis through the nail clippings. You know, you can clip the distal part of the nail plate and perform the diagnosis of psoriasis or onychomycosis. Maybe in the future, if we clip the trachonicia plate, we will be able to diagnose the causative disease. At present, more studies are necessary, more samples are necessary to validate the preliminary results. Psoriasiform pattern is also a possibility, so trachonicia can be an expression of nail psoriasis. Sometimes the clinical presentation is enough to tell you that you are facing psoriasis. As you can see in this patient, there is pitting. Irregular pitting is common of psoriasis, so you can say even without a pathology that you are facing nail psoriasis. Same with lichen planus. Trachonicia can be a presentation, a clinical presentation of lichen planus. Trachonicia is also a clinical presentation in alopecia areata. So especially children, it's very common to have alopecia areata of the nail presenting as trachonicia. Even in adults it's possible, but in children is much more common. But having alopecia areata and having trachonicia, it doesn't mean necessarily that you have alopecia areata of the nails. There are cases in the literature described where patient has alopecia areata of the scalp and lichen planus of the nails presenting as trachonicia. The treatment, as I said, is a benign and painless condition, so if it's not so bothersome for patient, you can decide even not to treat. Maybe it's better to start, if you want to treat, with topical agents, especially because most of the time you will deal with children, but you can also go for intralesional steroids or systemic agents. The point, the choice of treatment depends as usual on age, associated disease and severity of nail changes. So you have to discuss with your patient first which is the best treatment for the case you are dealing with. Steroids, the point, the choice of treatment depends as usual on age, associated disease and severity of nail changes. So you have to discuss with your patient first which is the best treatment for the case you are dealing with. Steroids, the point, the choice of treatment depends as usual on age, associated disease and severity of nail changes. So you have to discuss with your patient first which is the best